Hi, this is Bella. She's a 13-year-old Boston Terrier pug. She's spayed and her colors are black and white. Now, to start a physical exam, you want to start on the face, looking at their eyes to look for any signs of discharge, discoloration, or redness. Now, she does have cataracts and she's had carry eye since she was a puppy. You can look in their ears for any signs of infection or parasites, and their nose for discharge and the dampness of their nose. Now for the mouth. In the mouth you want to look for any signs of dental disease, but this is very important because this is where we'll take a CRT and the mucous membrane. Now her mucous membrane is bright pink as it should be, and to take a CRT you want to blanch till it turns white and watch for the color return. Now hers is also under 2 seconds, which is good. Now moving on, vets will palpate the throat to look for the lymph nodes to make sure they're not enlarged. And moving on to the abdomen. Now the abdomen, this is my dad. He has back problems, so this is kind of hard for him. So I'm trying to do it quickly. Can you move over so I can look at your abdomen? That's good, thank you. Now this is where we'll take a heart rate and respiratory rate. For a heart rate, you will place your stethoscope under the armpit. I find this is a good place to listen to the heart, and you will listen to it for 15 seconds. And you will also palpate the femoral artery to make sure the pulse strength is good, but I'm not going to do that because I learned my dog really doesn't like that. So I'll time her heart rate for 15 seconds. Now hers was 25, which was 100, so that's good for her. And for a respiratory rate, you want to, for heart rate, when listening, you also want to listen for murmurs. For respiratory rate, you can place your stethoscope above the lungs, watch a gentle fall and rise of the chest, and you will do this for 15 seconds again and count. Now hers was 7, which is 28, which is also good for a dog her size. Now moving on, you would take a blood pressure, which you would use a cuff on the legs or tail. It's okay. Here's some treats. You would use it on the legs or tail, wait for the cuff to inflate and deflate to get the reading, and you would do this multiple times and average the reading. Now, doctor or veterinarians will watch the grit of the animal to see for signs or problems in the musculoskeletal system. We'll also palpate the limbs, looking for any signs of swelling and pain. Now, moving on to the rear, they'll also palpate the abdomen to look for any signs of enlargement of the organs or discomfort. Moving on to the back side, you look at the genitalia and rectum for any signs of discoloration. Not discoloration, any abnormalities. And this is also where we'll take a temperature. For temperature, you want a proper rectal thermometer, put lube on it so it goes in easily, and take the temperature. Now you want to do this at the end of the exam because most dogs won't like this. And the temperature should be between 37 and 39 degrees. Thank you.
Good girl.